Hello friends, in a moment I will perform a bichectomy surgery on a patient. Actually, we were going to do combined body and facial aesthetics this week. However, our patient wants to do that 2 months later. She says, let me have the bichectomy and I'll come back for the others in 2 months. What had we planned for our patient normally? This patient is someone I did breast implants for 2 years ago and is extremely satisfied.
However, she had her nose done before as well. How long has it been since she had her nose done? She had her nose done 10 years ago, friends.
How many times have you had your nose done?
Once surgery, twice.
They did a revision, filing. So, friends, she had to undergo surgery on her nose 3 times and wanted to have it done again. Of course, I saw her nose now, and it definitely needs to be done, but it also needs cartilage. Therefore, when I come next, which is probably in 2 months, we will correct the nose with cartilage again, friends, because the nose has remained a bit like a ball. There are irregularities on top. The nose is a bit long and the tip is a bit droopy. I will correct these. At the same time, a prosthesis was discussed for another, but now I see our patient has enough fat. They want to slim the abdomen and waist, so I will do a fat injection. I will perform fat injection to the buttocks by taking fat from the abdomen and waist. At the same time, I will also perform leg prosthesis for the leg. However, right now, our patient said, let's just do a bichectomy. I'll come back in 2 months, doctor. We said, no problem.
We will meet again in September, but by performing the bichectomy now, we will at least solve one of the issues our patient wants. Thank you. Take care. Hello, friends. Yes, I performed the bichectomy on my patient. From the left side, nearly 4 cubic centimeters, and from the right side, nearly 3 cubic centimeters of fat, what we call a fat pad, is usually removed.
So as sometimes 4 comes out, or 3 comes out, or even 2.5 comes out. There can also be a difference between the 2 sides in some cases. Like in this patient, that the left side was thicker. Now, friends, we have removed this fat. Now it will look more aesthetically pleasing, like real beauty. This is a very high quality fat tissue, friends. In some patients, especially those with a tight chin, we can apply this to the chin tip or the cheekbone area for patients who want a bit of fullness, to the cheekbone or nasolabial folds or lips. It's actually a very high quality fat pad. Although this patient did not request such a thing, there is no issue with their chin, cheekbones or lips. But it can also be used for such a purpose. So when I perform a bichectomy, friends, not only do I rely on the bichectomy, but it's really possible to use that high quality, amazing fat tissue we obtain and apply it to different areas like the jaw corners, chin tips or lips. Our surgery was short, friends. It lasted about 15 minutes. Now, our patient wanted to sleep, which I think is more natural, more logical. Of course, it can be done awake with local anesthesia, but it is both traumatic for the patient and you can't achieve as good results. I mean, I did such a good fat removal here that it's really textbook-like. There is no problem at all. They will be quite satisfied.
Thank you. Much appreciated.